Hello, everybody. My name is Dr. Sheblaq. I'm a research professional in Saudi Arabia and in Jordan. I hope everybody are being safe during this outbreak. Today, my talk will be about one of the published um, paper that been worked very extensive last year, and I hope you will get like a fruitful conclusion at the end. The title is The Pattern of Off-Label and Unlicensed Drug Use in Adult and Pediatric Patients in the Kingdom of Saudi Arabia. It was a multi-center retrospective study as you shown in the affiliation of my authors. The background off-label drug use is referred to the prescription of a currently available and marketed medication for a use that has never been approved by the FDA. The reason toward that use can be a different indication that one registered, administered by a different route, given with a different dose, or given to a patient of a different age range rather than registered. The adverse drug reaction of some off-label medication were still not being reported and documented. Here is the integral role of the expert pharmacist in the medication review process, patient guidance, safety, and adverse drug issues. Nevertheless, there is no information available regarding the extent of the use of the unlicensed and off-label drug use in the Saudi Arabia and Middle East. Therefore, this study was conducted to address this issue, cover this literature gap, and provide data about the prevalence rate and the prescribing pattern of the use in different hospitals in the Saudi Arabia. The study design was a retrospective study conducting at 6 different hospitals in Saudi Arabia, including secondary and tertiary hospitals around the kingdom. Data were collected from the medical record of patients who visited or were admitted to the study hospitals between the January 2016 and July 2018 and were transferred into data collection forms. Data include demographic data, diagnosis, number of medication prescribed, complete regimen for each drug prescribed, dose, frequency, indication, route of administration and formulation, and if there is any adverse event encountered during the use of this off-label drug. Our main objective was evaluating the rate of off-label drug usage, identifying the percentage of morbidity and mortality by using off-label medication, classifying the most common off-label use medication in Saudi Arabia's hospital, determining the availability of policy and procedure behind prescribing the off-label, and at the end measuring the prevalence of adverse drug reaction associated with off-label prescribing and if there is any risk factor for development of any serious adverse event. Just go back. What are usually the reason for off-label drug use? Either contraindication in children for all age ranges, off-label use by an indication, off-label use by different age group, off-label use by route of administration, or lower than the approved license dose, or higher than the approved license dose. If one of these indications are used, we can name it as an off-label used. Our patient age classification here in the study was neonate from 1 to 29 days, infant 1 month to 1 year, children from 1 to 11 years, adolescents from 1 to 18 years, adult geriatric from 18 years and older. Sampling technique, we follow a consecutive sampling technique to collect the prescription from each site where every subject that met the criteria of inclusion was enrolled till the required sample size was achieved. The study site data were collected from 6 tertiary hospitals. Prince Mohammed bin Abdulaziz Hospital, Riyadh, we have 100, Security Force Hospital, 55, Al Yamama Hospital, 45, Maternity and Children Hospital in Mecca, 34, Prince Sultan Cardiac Center, 30, Prince Imam Abdulrahman Faisal Hospital, 21 patients. Data of a total will go with the result. Demographic and comorbidities. We collected 288 patients. Female represented 69% and male will represent around 30% respectively. According to age classification, adult and geriatric represent 89%, while children represent only 7%. Both adolescent and neonate represent 142%, where infant represent only 0.36%. The most comorbid condition were diabetic mellitus, followed by polycystic ovary syndrome, migraine, and hypertension. Frequency of prescription medication. The most common five prescribing off-label medication was antidepressant, amitriptyline, followed by antidiabetic agent metformin. A typical antipsychotic medication where quetiapine was the most frequently prescribed medication. Drug for infertility, clomiphene. Drug for treatment of enlarged prostate and androgenic alopecia was the finasteride. So these are the most common medication were encountered for in our study. Frequency of prescribing medication in adult and geriatric age was the top three are the antidepressant, antidiabetic, and atypical antipsychotic. And here we can see the gender, the pattern of prescribing according to gender, and pattern of prescribing according to age. Who's the the female was the most prominent, used more than female, and the adult more than the adolescent people. While about the children, sildenafil, spironolactone, folic acid, Singulair was the most common used medication off-label in the children in our study. Reason for the off-label medication was off-label medication by indication was 271, then different age group only 6, and then other reason like 10 patients. While what are the reasons for the off-label medication was the absence of symptoms, followed by the absence of complication, cured or controlled disease, and improved laboratory parameter is the indication behind this label prescription. Go over the discussion. Antidepressants were the most frequently prescribed, followed by antidiabetic agent and antipsychotic. It's not easy to relate or compare these results to those of other studies since most of the published studies were conducted to analyze the prevalence of a certain therapeutic class, not just like to get an over picture for all of these off-label medication. Antidepressants are frequently off-label prescribed. In the current study, amitriptyline was prescribed for 21% of the case for migraine, diabetic nephropathy, and fibromyalgia and IBS. Metformin was prescribed for 17% of our cases. This may be because it's known as to induce weight loss in overweight patients even without glucose abnormalities. If you were prescribed for 10% of the study's cases, this is justified that since most of the common that AABs are frequently prescribed as an off-label. Gabapentin was prescribed for 44%, and another study was conducted to analyze the prevalence of um, off-label of anticonvulsants at a private hospital in Indonesia. It was prescribed as an 18% of cases. So there is a different percentage from other studies or other countries even. Among students' children, the most common frequent medication, as we said, is sildenafil for pulmonary hypertension and diuretic as the spironolactone. These results differ from a study that was conducted to evaluate the off-label prescribing at the Kellogg Children Rehabilitation Center in USA, where the highest perception of off-label prescribing was cardiovascular system, respiratory system, genitourinary system, sex hormones, and alimentary tract system. Although neither adverse events, thanks God, nor serious adverse events have been reported of the use of label medication were used with no guideline to govern their use. So it is little bit high percentage that there is no guideline and even there is no like policy to govern each hospital toward this use. Our study has an obvious limitation, which is like a low sample size that hindered a deep analysis of the actual prevalence of over out of label in the Kingdom of Saudi Arabia. It's not easy to convince all of the principal investigator to measure this off-label medication. Especially, it's very difficult to get this information because there is no indication how being written as it's written and off-label. So we're collecting the data from retrospective chart as like an indication that are being approved as an off-label or is as in registered in the FDA. So some of the people he cannot agree to participate with us due to this difficulty in collecting this type of information. Conclusion: off-label prescribing was found in most adult geriatrics suffering from depression and diabetic mellitus. The most common reason for off-label was off-label use by indication. We have we got our main five recommendation, and we hope all of the hospitals or all the pharmacists all around the world just follow it. We recommend a strong collaboration between hospital and academic institution in conducting more studies for extensive analysis of the pattern of off-label and unlicensed drug use in adult and in pediatric patients in the kingdom and everywhere. These studies would be drug and age specific in order to deeply understand the efficacy and estimate the risk of off-label prescribing of each medication with respect to different age groups. Moreover, we recommend that such results are promptly reported to the SFDA to start planning for regulation regarding the off-label use of medicine around the kingdom. Pharmacists can play a major role in the off-label review process based on their medication expert and the high demand toward prescribing the off-label drug use. A well-defined policy across hospitals must be established to manage the use of off-label drug use in a proper way. And thank you very much. And I'm happy to receive any question or any further references of the published article if you're interested. Thank you very much.